In this lecture, we're going to talk about the introduction to education in the clinical laboratory and why you should care about education as a clinical laboratory scientist. So some terms that are going to be used, clinical laboratory science is used to describe the overall clinical laboratory profession, so the profession as a whole. Whereas clinical laboratory professional is referring to the person, the individual who is working in the clinical laboratory at any level of education. So this could be a medical laboratory scientist, a medical laboratory technician, a clinical assistant, just anyone who works in the clinical laboratory. And then there are more specific certification titles, such as medical laboratory technician and medical laboratory scientist. And these titles are awarded after you pass a certification exam. And your title, your certification title, might be different than your job title. For example, you might be hired as a clinical laboratory scientist or a laboratory information system specialist, but you have a medical laboratory scientist certification. So what is the role of the clinical laboratory scientist in education? So we have faculty members like myself who work in formal educational programs. You also have clinical instructors that are affiliated with educational programs. So that would be like the people who are working with you at your rotations that are teaching you at the bench. There's also coordinators that help with new employee orientation or with employee training. Supervisors are often responsible for competency testing programs. And you could also, as part of your career, be asked to speak at local, state, or national continuing education programs. You can also author professional articles and continuing education materials. You might decide that you want to start writing test questions for the national certification exam, or review papers or sites, either a clinical laboratory site or a clinical laboratory science education site for accrediting agencies. You could be a technical instructor or a consultant to other healthcare professionals or to the public on laboratory issues. So there's a lot of opportunity for clinical laboratory scientists to have a role in education. And one of the key things that we do is actually continuing education. And you might be asked to do an in-service continuing education program to create one for your coworkers. So there are types of educational programs for generalists. This is someone who's able to work in all areas of the lab. So there is high school plus formal training. So that would be people who do a phlebotomy certification program where they're trained to collect blood, also train on the proper way to transport, handle, and process specimens. And then there's clinical assistants that can do phlebotomy, clerical tasks, and some laboratory tests. Then you have your associate degree level, which is your medical laboratory technician or MLT, and they perform routine testing in all areas of the clinical laboratory. So they're not really capable of doing the high complexity testing, the non-routine testing. If you want to do the non-routine testing, you need a baccalaureate degree, which is a medical laboratory scientist or an MLS, and they perform the full range of laboratory tests. Plus, they're also trained on how to do testing, validation, and development, as well as management and education. And then there are specialty programs. So they receive, students in these education programs receive training in a concentrated area, such as becoming a hematology certification, and they perform testing only in that specialty, but they might also be doing management and education in that specialty as well. But if you have hematology certification, you couldn't really go work in the microbiology lab because you're not a generalist. So there are also master's degrees. So you have an entry-level master's degree program where you have a bachelor's degree and then you in a science or something, and then you go enter a entry-level MLS master's degree program where they teach you your MLS content, as well as the master's level education requirements. Or you can also get a specialization, such as like in microbiology or clinical chemistry or something like that. And then there's doctoral degrees. So this could be in a research-focused area, such as getting a PhD in immunology or microbiology. Or there's actually a new program now called a clinical doctorate in clinical laboratory science, or a DCLS. And these people are trained to go work on a healthcare team to basically be the advocate for the lab and to help doctors and the healthcare team choose the proper testing for a patient. So there's different types of MLS programs. These are for the baccalaureate or bachelor's degree. So there's the 2+2 program, which is the kind that University of Utah has, where you have 2 years of general education And then you follow that up with 2 years of medical laboratory science courses. There's also a 3+1 program where you have 3 years of general education in science, and then 1 year of your MLS specific courses. There's also a 4+1, which we kind of do here, where you have a bachelor's degree, usually in a science already, and then you can do a year of MLS courses. And then there is the 4-year integrated, where you take MLS courses throughout the entire 4 years of your bachelor's degree. And then there's also the entry-level master's degree, where you already have your bachelor's degree and you take your MLS courses as well as the requirements for the master's degree simultaneously. So is one type of program better? The most important thing is that it's a good quality program. And this is assured by going to an accredited program. So clinical laboratory education programs are accredited by NACLS, or the National Accrediting Agency for Clinical Laboratory Sciences. So accreditation is a process of external peer review, which an agency, in this case NACLS, grants public recognition to a program of study or institution that meets established qualifications and educational standards. So this is voluntary for an educational program to undergo. It is non-governmental, but programs will do this because there's a lot of benefits to this. A lot of times a university or a student cannot receive federal financial aid if they're not attending an accredited program. So that's one reason why accreditation is important. It also provides standards that you know are being met, so that then when you want to go take the board of certification exam, they can go, oh, you came from an accredited program. We know that they do a great job with education, so you don't have to jump through as many hoops in order to take the board of certification exam. So the process of becoming accredited by NACLS, the first thing that the program does is they write an application and perform a self-study, and then they send that to a peer reviewers that are contracted by NACLS, and they do a paper review just to make sure everything looks good. And then they actually come to the educational program called the site visit and make sure that everything that the site said happens is actually happening. And then after the site visit happens, they write up a report. NACLS reviews that report, sends back any concerns to the program. The program then has an opportunity to respond going, oh, hey, you said we didn't do this. We actually do. Here's the evidence of that. Or you're right, we don't do that. We need to work on it. Here's our plan to work on it. And then NACLS will make a decision and decide if that program will be accredited or not. So there are different levels of accreditation. So if program for NACLS, a program can be accredited for a maximum of 10 years. That means that all standards are met. They didn't receive any citations in their previous cycle, and they haven't been inactive or on probation in the previous cycle. And even though you get the 10-year certification or accreditation, you still have to do a 5-year interim report that you send to NACLS, basically being like, we're still doing good stuff, guys. And then there is being accredited for 5 years. Where this is usually a new program can only get accredited up to 5 years. And any programs that don't meet the 10-year criteria, either because they didn't meet all the standards or there were some citations, they can get accredited for up to 5 years. And then there's also the option for being accredited for less than 5 years. And that happens when there are some citations or, and once they are compliant, they can then have that accreditation extended past that initial lower time. There's also probationary accreditation. This is when a educational program receives multiple citations and that the NACLS feels threatens the education of the students. So this probationary accreditation can last for 6 months to 1 year. NACLS can also decide to withhold accreditation. So this could be for new programs that don't meet the standards and have deficiencies that are not easily corrected. So if it's something they can correct, they will give them the option to remediate that. And then you can also have your accreditation withdrawn. So this is when an existing program doesn't meet standards and remediation attempts have failed. So at that point, NACLS withdraws its accreditation and the program can no longer basically enroll students anymore and say that they're accredited. And programs can also request to be inactive. So say for whatever reason their university has decided to stop funding a medical laboratory science program, they can ask to be made inactive so that eventually when they do get funding or they can restart the program, it's an easier process to get reaccredited. because they're not starting as a new program. They're starting as one that was previously inactive. So these NACLS standards, these set the minimum qualifications for a program. So these look at things like faculty qualifications, making sure that the faculty are medical laboratory scientists, that we have advanced education, that the curriculum meets standards, that there are evaluation methods in place to ensure that the students are learning what they're supposed to be learning, that we have affiliation agreements in place with hospitals to do clinical rotations, and that we have posted our program outcomes. So that includes things like how many students who graduate from our program pass the certification exam in the first year, how many of our students who graduate get jobs, how many of our students actually graduate. So all of this has to be readily available on the Medical Laboratory Science Education Program's website. So if you go to ours, you should be able to find it really quickly. So what happens if a program loses accreditation? So first of all, if the program does lose accreditation, they should notify students that are currently enrolled that the program is on a probationary accreditation or that it has been withdrawn. And as a student, you might be freaking out because you're like, oh my goodness, what happens if my program loses accreditation? I'm able to take the board certification exam. Luckily, there are safeguards in place so that if the students who are currently enrolled in the program, they are allowed to finish out the program during that withdrawal or withheld period, and it will be as though they have graduated from a NACLS accredited program. So it's basically no fault to the student that their program got their accreditation withdrawn. So they will still be able to take the board certification exam, and it will still look as though they've graduated from an accredited program. So certification, this is different than accreditation. So accreditation basically makes sure that the educational program itself is good, whereas certification is looking at the individual's qualifications and that those individuals' qualifications are being recognized by a non-governmental organization or agency. So this provides assurance to the public and to the employer that this individual is competent in medical laboratory science. So certification is voluntary. You don't have to take the board certification exam, but you do need to be, if you graduate from a NACLS accredited program, you will be eligible to take the board certification exam. And there are different routes to eligibility to take the board certification exam. So that can be due from graduating from a NACLS accredited program, working for a certain number of years in the field, or taking a certification class. So why would anyone volunteer for this? One of the key things is most employers prefer to hire employees who are certified. And in certain states, employers are not allowed to hire employees unless they are certified. So if you want a job in medical laboratory science, you pretty much need to be certified. So there are certification agencies. One of the main ones is the American Society for Clinical Pathology. Their board of certification are the ASCP BOC, and they will certify medical laboratory scientists where you get an MLS ASCP, or if you have the associate's degree, you would become a medical laboratory technician or an MLT ASCP. There's also the American Medical Technologists or AMT, and they will certify medical technologists or medical laboratory technicians as well. And then there are also other certification agencies such as the American Board of Clinical Chemistry or the American Board of Bioanalysis. And these are usually more reserved for people who are trying to become lab directors who have PhDs and have gone through either routes of experience or through fellowship programs in order to become a lab director. So one part of certification is maintaining your certification. Once you take that exam, doesn't mean you're done. They want to ensure that you are keeping up on current trends. So there's certification maintenance programs, and subsequent to 2004, certification maintenance programs are mandatory for anyone taking the ASCP Board of Certification. And you have to basically renew your certification every 3 years and document that you have completed at least 36 hours of continuing education. So these can be formal courses such as those offered by the ASCLS, or ASCP also offers courses as well, or they can be employer-sponsored CE, such as in-service presentations. And or if you manage to take an advanced certification exam, such as like a specialist in hematology or specialist in chemistry, that kind of counts as your 36 hours. So fun fact, writing a dissertation for your PhD counts as 10 hours. So you have to document this 36 hours, send them documentation that you've completed it, and then pay a fee to basically renew your certification. And if you got your MLS degree certification prior to 2004, it is voluntary to do the certification maintenance, though it is encouraged. And one reason because of the certification maintenance is why there's medical laboratory scientists are encouraged to learn about education, because you might be expected to prepare these continuing education presentations. All right, so registration sometimes gets confused with certification. So the ASCP has a registry, which is basically a list of individuals who have been certified. So if you are registered, you have your name on that list, but it's not the same as actually being certified. So sometimes people refer to the certification exam as the registry exam, but it's technically a certification exam rather than a registry exam. So licensure. So certification was through a non-governmental agency. Licensure is through a governmental agency. So this is where the government has written laws that state that an individual has to meet certain requirements to work in a particular occupation or hold a title. So this basically assures the public and the employer of competence, because some states don't think that taking a national certification exam is sufficient. So this is at a state level rather than at a national level. So there is no such thing as a national licensure. It is state specific, and not every state has licensure requirements, and the requirements vary by state. So some states just require that you graduate from an accredited program. Some states require that you have passed the board certification exam. Some states like California require that you have a certain number of clinical hours, which is why one reason why California is one of the more difficult states to get licensure in, because you pretty much can't get licensure directly out of an MLS program without having graduated from a California MLS program. They just don't have enough clinical hours. All right, so there are some pros to licensure, which is why it's a thing. It defines the scope of practice. So for example, it says that only nurses can do nursing stuff. Only laboratory people can do laboratory stuff. But then there's also some nurses do laboratory stuff, like the point of care test. So there's a little bit of gray zones, but it helps define who can do what. It also improves quality because only licensed individuals can perform tests. It improves the image of the laboratory profession. And there's some theories that it might increase salary. What I've noticed, having lived in a state where licensure was a requirement, it has made it very difficult to recruit trained licensed people into the state. And that can cause problems with staffing. So the licensure cons, there's the increased cost because you have to hire licensed individuals. There's a lot of personnel shortages because finding a licensed MLS can be difficult, especially in states that have the more strict licensure requirements, or if you're trying to find a licensed individual for a rural area or smaller settings, it just makes it more difficult to staff your lab. And what if you wanted to work in California because that's where you need to move for whatever reason, but you lived in a state without licensure? It is a lot of effort to get licensure in one of these harder states like California. It costs a good amount of money as well. So it can kind of be prohibitory for people moving to a state. So another thing I want to talk about is HIPAA, which is the Health Insurance Portability and Accountability Act. And this basically protects the privacy of protected health information, or PHI. So students in clinical rotations will receive HIPAA training. And as an educator, we have to know about HIPAA, because if you're using patient samples that you got from the hospital, because some things are just really hard to fake, then you have to make sure that those samples are de-identified. And also, if you're using patient data for a case study, you also need to de-identify it. So as an educator, it's also important for us to understand HIPAA. In addition to HIPAA, there's FERPA, which is basically like HIPAA for students, where this FERPA stands for the Federal Education Rights and Privacy Act. And it basically protects the privacy of student records. Just like HIPAA protects the privacy of health records, FERPA protects the privacy of student records. So any student over the age of 18 or attending school beyond high school, so if you were 17 and a college student, this would protect you as well, you have the right to inspect, review, and correct your records. So some things that are not protected by FERPA by default is directory information, such as like the student's name and phone number. That can be put in a directory unless the student chooses to opt out. And then some examples of protected information includes things like your grades. That requires the student's permission to release that information. So here are some fun examples of FERPA that we see in education. So I received a call from a laboratory supervisor who is interviewing a graduate of my program. Can I tell the supervisor that the graduate was an A student? It's not like you're telling them bad stuff. So like, you might think, yeah, sure, I can do that. I'm not going to do anything that's going to hurt them, but that is FERPA information. You're telling them basically that it's an A student. So you would need written permission from the student to share that information. Another question. I like to have my students grade their classmates' pop quizzes. Is that a violation of FERPA? Technically, peer grading is allowed under FERPA, but once the instructor takes that information and uses it as part of a grade, it then becomes protected information. So a graduate of my program opted out of making his directory information public. A potential employer is now trying to reach him about an exciting job opportunity. Can I give the employer the graduate's phone number? He's opted out now, so no. Unless the graduate has revoked his opt-out decision, you have to continue to honor it and not tell this potential employer the graduate's phone number. What you could do is contact the graduate yourself and say, hey, this employer wants to get a hold of you. Let me give you their phone number so you can reach out to them. That's something you could do. I think this one's funny. Does calling students by name in a classroom violate FERPA regulations? Luckily, no. Students don't have the right to remain anonymous in class. Can you imagine how annoying that would be as a teacher to not be able to say any student's name in class? I'm glad that one's not FERPA. So the next question is, I'm a student in an MLS program and I know I have the right to look at my educational file. Does that mean that I can see the letters of recommendation that were sent in during the admissions process? That depends. So a lot of times when you request a letter of recommendation, there's a little box that you check saying that I waive my right to read this letter. And it's highly recommended that you check that box because that means that the person writing the letter of recommendation can give a more honest review of the student, and those recommendation letters that have the rights waived are seen as more honest by the people reviewing the letters of recommendation. If you didn't waive that right to see a letter of recommendation, you could go ask to see your student record and see that recommendation letter. You do have the right to know what is in the file, including the names of the people who wrote the letters of recommendation, but unless you didn't waive that right, you can't actually read the letter anymore. Once you waive that right, you have waived the right to read the actual letter. And then I'm a faculty in an MLT program. A parent of one of my students called and wanted to discuss the student's performance in my class. Can I talk to this concerned parent? No. The student has to give permission to speak to anyone, for you to speak to anyone about his or her grades. So there's this exception to this rule if the student is a dependent of the parent for tax purposes. However, an educator's not going to know that. So it's best just to get the student's permission so that way you don't accidentally provide FERPA information to someone who's not allowed to get it. And then, can an educational program disclose student records to an accrediting agency without the student's consent? So yes, so educational programs can disclose student records if the accrediting agency needs to see the records in order to carry out their functions. For example, when we have a NACL site visit, they might ask to see an example of a student file to see that we are maintaining the records the way that we say we are. But it's not like they're going, oh, John Doe made an A and like making note of it. They're just making sure that the records are being maintained properly. All right, so that was FERPA. Now we're going to move on to the Americans with Disability Act, or the ADA of 1990. So this basically prohibits discrimination against individuals with disabilities who are otherwise qualified for admittance to a program. So you cannot exclude an individual who's otherwise qualified solely based on the student's disability, if reasonable accommodations are possible. So reasonable accommodations is kind of a gray area. in general, I feel like medical laboratory science education programs are very willing to try to do reasonable accommodations. The only time when accommodations can't be met if it would change the program standards or face undue burdens on the program to accommodate that student. But for example, you can have people who are deaf, you can have people who have limb differences, people with ADD, all kinds of disabilities or reasons why someone would need accommodations. Even pregnancy is considered a reason for accommodations. So in order to help define whether a student would be successful in the profession or in the program, NACLS and the ADA have written up essential functions. So these essential functions describe the physical skills and personal attributes needed for the program, for successful completion of the program and for the profession. So for example, in medical laboratory science, the ability to differentiate colors. So a lot of the reactions that we read, a lot of the cell morphology that we do is based on color. So if someone can't see color, they can't necessarily perform some of the essential functions of the profession. Or the ability to modify behavior based on constructive criticism. You need to be able to improve. You need to be able to know when to seek help. So things like that are considered essential function. If someone cannot meet those essential functions, then medical laboratory science is not a good profession for them. And these essential functions are designed in order to help the applicant judge their ability to succeed in the profession. And these are published usually on a medical laboratory science education program's website so that the applicants can judge for themselves if they feel like they can do it. All right, so there's also non-discrimination laws. So these are federal laws that protect students against discrimination. So there's Civil Rights Act of 1964 that prohibits discrimination on the basis of race, color, sex, religion, or national origin. Then there's Title IX of the Education Amendments of 1972 that prohibits discrimination on the basis of sex. The Age Discrimination Act of 1975 that prohibits discrimination based on age in programs receiving federal funds. So this is age, either if someone's really young or old or any age. You can't discriminate based on age. And then the Americans with Disability Act of 1990 prohibits discrimination against individuals with disabilities. And then there's safety laws. These are usually aimed at educational programs. So these are federal laws that are aimed at improving safety. So there's the Clery Act, which requires universities to provide information about campus crimes and to share information about efforts to improve campus safety. And then there's the Violence Against Women Reauthorization Act of 2013 that requires universities to report domestic violence, dating violence, and stalking. And all faculty and students on a campus should know how to report an incident and about campus resources for compliance and how to report non-compliance.